Hello, this is Dr. David Pomeroy, your host of the podcast ADHD Focus. And today I have one of the true experts in the field of ADHD, whom I've been privileged to meet and talk with at various conferences. Dr. Thomas Brown is a Yale-trained clinical psychologist, specializes in the assessment and treatment of ADHD and related problems in children, adolescents, and adults. He served on the clinical faculty of Yale Medical School for 25 years and then relocated to Manhattan Beach, California to open the Brown Clinic for Attention and Related Disorders. He is also a clinical professor of psychiatry and neuroscience at the University of California, Riverside Medical School. Dr. Brown has published 30 peer-reviewed journal articles and written 7 books on ADHD, his latest one on Asperger's and ADHD. Tom, it's a privilege to have you on the program.
David, I feel honored to be invited back, and I'm very happy to have this opportunity to talk with you.
And I'm not sure I had the title right on your latest book about ADD and Asperger's. Has that been published yet? Or
Yes, the title of it is ADHD and Asperger Syndrome in Smart Kids and Adults. And then the subtitle is 12 Stories of Struggle, Support, and Treatment.
Great. And that's basically what we'll be talking about today. And in one of your webinars, you made the distinction between Asperger's and the autism spectrum disorder, which now, according to the DSM-3, they're rolled together.
Yeah, they did get put together, and I think frankly, I think it was a mistake. That's one of the things I argued in that book on ADHD and Asperger's. It's not a main theme of the book, but I did say that I think that the needs and the abilities of people that we call Asperger syndrome, which is, one way of thinking of it is sort of the higher IQ end of the autism spectrum.
Mm-hmm.
If you think about the autism spectrum, there's autism where you have somebody who barely has any language.
Right.
And who has a lot of difficulties even with basic motor skills and such.
Mm-hmm.
And then you've got this spectrum that goes up all the way to people who have very high IQs,
Mm-hmm.
But do have some difficulties in terms of reading emotions and getting along with other people. And so I felt like it was useful to have the separate category of Asperger syndrome as sort of a subset of people, on the autism spectrum, just to recognize that these are people who have different strengths and different problems as a result.
Mm-hmm. Yeah, I agree with you that I wouldn't, when I'm thinking of people I see, many of whom are programmers, and that's often a strength of theirs to have that hyper focus. I wouldn't think of them as being in an autism spectrum. I think
they're very, very different in their strengths and also in their needs.
So how does Asperger show up in children? Is it different than adults? And these are people not yet diagnosed.
Yeah, the things that you hear about, in terms of the sort of what the kids are like, is that they often are, if it's going to be somebody that we would be likely to think of as Asperger syndrome, that usually means they've got at least average smarts,
Mm-hmm.
and very often quite a bit above average smarts. But there are a couple of ways of looking at it. One is to look at how people describe their kids who may be in that category. And I had one example I was thinking of. This is a kid that I saw when he was 11 years old, and what he said to me is, I'm in school to work ahead and to get to college faster, where I can be around others who are very smart like I am, and who will share my interest in music and theoretical physics. I don't have friends at this school. I'm lonely there. The other kids aren't like me, but at least I'm not getting bullied like I was in my last school. I used to be pretty depressed and had thoughts of suicide, but that's been better recently. I still worry, though, about what it'll be like if I'll meet my goal to skip ahead to a higher grade. And then when I asked him to tell me a little more about this, he said, I'm a nerd who's in school to work ahead. I get along better with grown-ups and older kids than with kids my age. I don't have any friends at school. I'm lonely there. I want to get into high school as an 11-year-old as soon as possible, and then get into college where I'll be with other people very smart like I am. When I get there, I want to major in theoretical physics and minor in law or business. I've always had trouble focusing on anything for long. I've always had depression and have had some thoughts of suicide. I've had also migraines. I'm germ phobic. I wash my hands until they're red and raw. I also fidget a lot with my feet. So you can see that he's a very articulate kid.
Yes.
But you can imagine how that makes it a lot more difficult in getting along with other kids, and doesn't have a sense of how talking the way he is, where he places himself way above all the other kids, is likely to turn off kids.
Yes, yes.
And another source of another way of trying to answer the question of how are people who have Asperger's, how do they show up in childhood? There's a study that Baron Cohen did. He's a Brit who's written on this, and he had a bunch of Asperger's adults and got them to talk a little bit about what they were like when they were kids. And some of the things they mentioned were they tend to be loners. They don't know much about how to interact with other kids their age. They remember themselves as preferring to talk with adults, that they didn't get very often invited to play at a classmate's home or even to birthday parties. Another one had said, I wasn't much into social pretend play. I was more focused on building things or reading factual books. Another one was saying, well, I think I'm like a lot of my friends who have Asperger's. We have very intellectual interest to high levels. We like to learn facts, and most of us are really very knowledgeable, at least on a few specific subjects.
Right.
And often that's all they'll talk with you about. But the other thing was, a lot of them said that when they were in school, it was a problem because they were really smart and could get a lot of the things that needed to be done for their schoolwork, but often they wouldn't hand in some of the schoolwork. Even though they understood the stuff and could pass a good test on it, the homework wasn't getting in, and some were failing academic subjects.
Yeah, I wonder whether some of those kids are basically bored. I mean, that
Some of them
teacher
probably
explains
are.
something in math and, okay, I get it. Why do I have to do 12 problems?
Why should I have to bother doing these problems?
Yeah.
Exactly.
And then why should I have to bother turning in the homework? Because
why should I have to bother going to school in 6th grade when I'm ready to go to 10th grade?
Right. And that's an even tougher social jump.
It is.
Sure. So yeah, I've heard adults specifically, or I could say thinking back on patients where the factual books, factual things are where their interest is not.
And often they're very good with it.
Not one place the fantasy type thing may come up is with video games.
Yes.
Because many of, and I don't know enough about them to know whether there's some multiplayer ones that are intellectual or whether they'd be loners in that.
Some of them are very challenging, and they can often find other kids who are very bright and very good at doing those games.
Yeah, and if their work is boring, then they're more likely to fall into the games. Then it gets into the kind of same thing. Why do the homework? As in,
right.
why do my
There are
job work.
some schools that have programs for their higher IQ kids. Not all
Mhm.
of them have Asperger's, but the kids who can do more, and they try and provide more opportunities to do things that'll be interesting to them.
Yeah,
But a lot of schools, it's not that easy to do that and to also cater the needs of the many other students who have different needs.
yeah, there's one school here in Bellevue, Washington, that is more project-based.
Mhm.
So instead of the classroom learning and lectures, they're doing projects
Yeah,
on.
and for some
and other
students, that works
incorporated.
very well,
Mhm.
at least for some of the curriculum.
So some of the things you described in this 11-year-old would fit into ADHD kind of things, can't sit
That's right,
still.
and there's a very high percentage of kids and adults who have Asperger's who also have ADHD.
Mhm. Is that on the order of 50%?
It depends on which study you look at and how they're measuring it, but all I can tell you is I think we're talking about something that's closer to 75% than it is to 50.
Wow. So what are some of the common things that ADHD and Asperger's share in terms of whether it's symptoms or abilities?
Well, I think the people with I think it's important to mention that among those with Asperger's, there are a lot of different personalities.
Mm-hmm.
It's not like there's just one picture that matches all of them. In terms of personality, there's some of them who are kind of arrogant know-it-all types
Mm-hmm.
among those with Asperger's, but there are also some others who are kind of fearful and kind of avoidant and clingy to adults. There's some of them who act like little adults and are trying to take care of everybody else,
Yeah.
sometimes to boss other people around. And others are kind of fragile and also perfectionistic, and many of them get into being rule enforcers. So it's like they identify with the adult in the room rather than with the other kids of the same age.
Yeah. Yeah.
So my point is just that it's not like there's just one personality type among people with Asperger's, but what they have in common is that they can be extremely bright and often have a lot of factual information about particular areas that they're interested in.
Right.
But they tend to be often kind of clueless in terms of social interaction.
Mm-hmm. Mm-hmm.
And that gets to be, pretty problematic, and it gets on the nerves of other kids. And as a result, then often the other kids are going to just, sort of push back and try. But
Exercise them.
this is a little piece of that I'd written down about a boy who was 12 years old, and his name is Sam. The parents talking, and your mom said, Sam's doing okay in his schoolwork, but he gets teased a lot, and he makes trouble for himself by being too critical of other kids.
Yeah. Yeah.
Despite what we tell him, he can't keep his opinions to himself. He's always quick to point out when another kid makes a mistake, not only during classes, but also in practices and games with his baseball and basketball teams.
Mm-hmm. Mm-hmm.
He starts middle school in 2 months, and we're really concerned about how he's going to get along socially there.
Yeah, I think that the kind of intersection of a lot of factual knowledge and a black and white thinking that this is the way it is.
Mm-hmm.
So how come you aren't doing it that way? That's what the rules are, and that's the way it should be done.
Yeah, and the thing that's missing there, of course, is a sense of how what they're saying is likely to be received by the other kids.
Mm-hmm. Mm-hmm.
That most kids who don't have Asperger's are going to be able to, they may not always pay attention to it, but they can tell when another kid is going to get angry or annoyed or retaliate, if you start acting like you're the adult telling them what to do.
Yeah, and maybe a couple times that happens, and then they learn from that experience. And
Right, yeah, but
they're thinking, well, I know you're not doing it right, but I'm gonna let that
but
go.
they don't have to open their mouth and start acting like they're the ones who are supposed to tell people what they should do and what they're not doing. Now it's not like every kid who does that has Asperger's.
Right.
But those are a couple of the characteristics you see sometimes with Asperger's kids.
I'm thinking of one man who's now in his early 30s, and he had played soccer, and he's just totally into soccer. He knows players in the Premier League and La Liga and all these other different international ones. And he's a referee.
Yeah.
And boy, he knows exactly the rules of one thing or another. I'll be watching a game with him and say, why was that a foul? And bingo, it's almost like he can recite the rule book.
He probably can.
Yeah, he probably is coming up exactly with that language, which is a good way to be, because nobody can argue with him on the field.
Well, but they also don't have to like him very much.
Right. It's that what he says goes, and that's
it is. If you're playing on a kid's soccer team and the ref is that way, you don't have to like him, but it doesn't pay to argue with them much, or you're going to get yourself thrown out of the game.
Yeah.
However, if it's another kid who's acting like they are the referee or they are the coach, they're the ones that's criticizing, the one who is criticizing you. There are ways kids have of getting back to kids who do that kind of thing. And often you end up with, the kid who's being excessively critical, getting dealt with kind of harshly or just isolated.
Now, how does, what's the percentage, would you say, of girls with Asperger's, or has that even been?
Well, there are not very many studies that have really nailed that down, but the fact is there are some. I think that we're probably talking about maybe a quarter to a third of the people with Asperger's are girls or females. And they have some very similar traits, but often are, they're smart, and they often show that off a lot.
And I'm thinking, I think it tends to be girls than boys who have ADHD, may not have the Asperger's part, are very perfectionistic. It seems to be just so. And I'm speculating whether this is, as they were in their younger years, they're always told, oh, you're wrong, this and that. And they're convinced, okay, if I'm perfect, I can't be criticized. And I'll have to think back on some of my patients in terms of, okay, how does this maybe look into the perfectionist area? And there certainly are girls that are loners and fit many of those things. They'd rather be talking with adults, and yes, they can carry on very intellectual conversations. So are there some co-occurring conditions that tend to run along with one or the other that are common? I'm thinking of anxiety, which in my experience is almost central to Asperger's and autism.
That's true. And of course, we see elevated rates of anxiety in people with ADHD too. If you think about in the general population of kids, you usually find that it's about 5% would really qualify for a diagnosis of anxiety disorder. And among kids who have ADHD, it's about 35%.
Yeah,
a little over a third.
The aspect of Asperger's, which is and maybe it's I'd like your opinion on whether it is as prominent in those people to have an anxiety because they're so sensitive to stimulation. They get overwhelmed by light, sound, noise, and
Yeah, that's true, not in all people with Asperger's syndrome, but in many. And sometimes it's too much input. If there's someone who like loud music, like many other teenagers do, but there are also some who don't like anything that's loud. They don't like a lot, like flashing lights, or even things like the tab in the back of a shirt. That they're kind of touchy about stimuli that are impacting on them that they don't really want. So you end up sometimes with parents having to cut the labels out of the back of the shirts, or
and I think that
accommodations.
Tends to be present in kids with ADHD too, particularly the texture or of clothes, even of foods.
That's right.
And that can be,
and you can see that with ADHD, and you can see it also with Asperger's syndrome.
and I know there's seems to be more publicity about not just eating disorders, anorexia, but this avoidance restriction of food, which seems to have a basis in the texture or color and those kinds of things.
Yeah.
And maybe more present in autism. I don't think of that as specifically so much with ADHD.
No, but you do get it with some people have ADHD, and you get it with some people have Asperger's syndrome.
Yeah.
And I think the other thing to keep in mind is that they're among those people on the spectrum, the autism spectrum, there are a lot more people who are, up in the at least average smarts range than not. So that I think there's been a real need for and a successful effort to provide more adequate education and support for kids on the autism spectrum who are lower functioning, don't have much language, and who have a lot of difficulties in coordinating physical movements and so forth. But that's really a minority.
Yeah.
People on the autism spectrum. And it goes, it genuinely is a spectrum.
Right. And I think certainly when I was in medical school and early practice, when someone mentioned autism, the picture I had, and I think many people had, was a 3-year-old who regressed in language, now really can't function on his own, feeding or anything else. And much like ADHD, which I think in the 1980s and 90s was hyperactive 8-year-old boys.
Right, exactly. That's where it wasn't recognized that the diversity of cognitive abilities.
Yeah, and that
in people with ADHD, and the emphasis was very much on just for years, for decades, it was just referred to as hyperness.
Yeah,
all the hyper kids, and those were the ones that we gradually have learned to see as the ones who have ADHD, and the model of ADHD, which I use and have written about quite a bit, is one where you can basically write an equation that says ADHD equals impaired executive function. It's like the management system of the brain.
Right.
The model I work with has in it half a dozen different components. There's being able to get organized and get started on one thing. There's being able to focus and then shift focus when you need to focus.
Yes.
And then there's also it's not in the DSM criteria, but the model that I and a number of other people are using also includes regulating alertness, which is being able to get to sleep when you need to sleep and be awake when you need to be awake.
Right, and sleep is,
Being able to sustain effort. And
keep with it.
being able to I'm thinking about a kid who said, my mind is a great sprinter, but it's a lousy, distance runner.
Yeah.
And if
that's
whatever I'm going to do
good.
is something you do quickly in one chunk and you just go all out for it, and then you're done with it quickly, I'm
Mhm.
fine. If it's something where you can't do it in one quick chunk, you have to keep chipping
Yep.
away at it day after day. So that I have a lot more trouble with, and many people
Right.
with ADHD say the same. And then there's also a processing speed thing that many people who are quite bright who have ADHD also are kind of slow. And for example, they may, if you ask them to write an essay or several paragraphs about something, often they've got some very good ideas about what to do, but it takes them half a forever to get the sentences and paragraphs out.
Yeah, yeah. And
So
what's
that kind of thing. And then the fourth of the 6 clusters in the model that I work with for ADHD has to do with managing emotions.
yeah, that's a big
That
one.
many times people with ADD struggle, and it's different things for different people. There's some
Mhm.
people where they've got a short fuse. For example,
Yeah.
talking with a guy the other day who he said, I was in the diner having lunch. I'm in a pretty good mood, sitting eating my sandwich. Guy in the booth behind me gets his sandwich. He's chewing too loud. He's going chomp, chomp, chomp on every bite. He said, there was something about that noise was driving me nuts. It was as though a computer virus had gotten into my head, and just that's all I could think about. And he said, I'm sitting there with my fist clenched, seriously thinking about getting up and smacking this guy in the mouth because he was chewing so obnoxiously loud. He said, I didn't do it. I didn't want to get arrested.
Mhm.
If I'd been at home, I would have been yelling at somebody or walked out of the room. He said, but then after a few minutes, it passed.
Yeah, and I've heard of people with ADHD saying, I would yell at my sister because she's chewing her mashed potatoes too loudly.
Yeah, right. The mashed potatoes.
And the same kind of thing, they get that into your head and they can't get that out.
Yeah, and
when
and there are other emotions too. There's some people
yeah.
with ADD who have a lot of trouble not managing their anger, but managing their worry.
Yeah.
Constantly freaking out about, oh, this is going to be terrible, this isn't going to work. And then other people who get really very sad very quickly, and they give up. The minute it looks like there's one cloud on the horizon, they're assuming that we better cancel the picnic.
Yeah, yeah, and that's I think of it as a kind of a variation of anxiety. Yeah, the
Well, it
worry,
is, yeah.
and then they shut down because
Exactly.
oh, that's too difficult.
But managing emotions is a thing which is a problem for all of us sometimes. But among people with ADHD, that they're not all having trouble with the same emotions.
Mhm,
Sometimes
mhm.
it's the hurt feelings. I was talking with a businessman, last month, and he was telling me about how he's walking down the hall at work, and a friend of his who worked in the other department was walking by, as looking at some papers as he's walking, and he hadn't seen him for a while, so he stopped and said, "Hi, how you doing?" And the friend looked up from his papers and said hi, and kept right on walking. And he said, all day I kept thinking, did I do something to piss him off? Or
Right, right.
why wasn't, it didn't occur to him that maybe he was on his way to a meeting where he had to do something about those papers.
Yeah, yeah, and he was
And
intently reviewing them.
feelings were hurt, and he was just, thinking about it all day. So there are different ways of with different emotions. Some people get scared. I was talking with a woman about a month ago, and she was saying, I'm in the left side of the freeway, and I'm in the left lane, and next to me in the next lane over, there's this huge semi. And she said, I was looking at it, and she said, I have this thing of what if, that
Yeah.
sometimes, and so I'm looking at this semi, and we're going about 65 miles an hour, both he and I. And I know that he can't see me because he's way up at the front and I'm back in the middle of about the length of this very long truck. And so he has to look at me through his mirrors, and I'm wondering, does he have his mirrors set right? Can he
Right.
see
And
me?
he's looking
And
down
she's
some,
thinking
yeah.
about if he doesn't see me, he could just decide he wants to get in this lane and come over and squish my car. And pretty soon I'm not just thinking about it as a possibility. She said, I'm running a very vivid movie in my head, imagining exactly what it would look like if that truck came over and smashed into my car. And then the truck jackknifed, and cars and trucks were hitting us repeatedly. Massive traffic jam, takes a long time to get the rescue squad and cut me out of the car. By that time, I bled to death. I have to call my family and tell them I'm dead and all this. Well, I'm trying to drive the car 65 miles an hour down the road.
Yeah.
So
yeah.
that's just a different type of emotion.
Right. And I've
but it's
heard
different ones, for different people.
Yeah, and patients, I think of one woman that was talking about that exact same thing and was finding it happening so often in different situations that she's scared to drive. Saying, I don't know whether I'm going to react in the wrong way because I'm thinking about all this.
Exactly.
And am I going to try to get away, or all of a sudden take an exit or whatever? So she said, it's better if I don't even drive.
Right. And that's a sort of being overwhelmed with a fear.
Right.
It can be helpful if you've got enough fear about it to be careful.
Right.
But not so much that you get gobbles up all the space in your head.
And maybe the fear is overriding the thought of,
absolutely,
I could just slow down.
Yep.
And not have to worry about being right next to him.
And then another piece of ADD, besides difficulty with regulating emotion, is memory. If you ask people who have ADD, how's your memory? Often say, I've got the best memory of my family. I can remember stuff nobody else can remember. They'll give you some example about some movie they saw 5 years ago. And they can tell you every detail of the entire storyline of that movie that they saw 5 years ago. Haven't seen it since. But then if you ask them about other things that they remember, they'll tell you, all the time I'm walking into rooms thinking, what the hell did I come in here for?
Yeah.
Downstairs to get something you need for a project you're working on, see something else that's interesting, something else that needs doing, and soon you're up to your elbows in project number 2, having totally forgotten you were in the middle of project number 1 upstairs. Was kind of important to get it done.
Right.
So that short-term working memory is the big thing, because some people with ADD have very good long-term memory.
Oh, yeah.
But they have a lot of trouble just remembering what you just said or what they were about to do. And
keeping the focus on what you're doing now so that you can continue with it.
Yeah.
And like you say, go into another room or go open the refrigerator looking for something, and then, and you see something totally different, and then take that out.
That short-term working memory problem is a big piece of ADHD for a lot of people who have it.
Is there a good way to test working memory and processing speed that is not just a kind of one-on-one in a neuropsychological evaluation where you're being asked to remember numbers forward and back, which to me doesn't seem a very practical application of working memory?
No, I'll tell you, the one that I use when I'm doing evaluations is a thing that's part of the Wechsler memory scale. I don't use the whole damn thing. It's a big, long test, but they have 2 stories. Each one has about 25 word units in it.
Okay.
And I'll just say, I'm going to read you 2 short stories. Each one's just a paragraph. Please listen carefully. And then after I finish reading this story, I'm going to stop and ask you to tell it back to me as close to the same words as you can. I'm not saying that I don't want just a summary of it. I'm asking for you to try and remember the words that you've heard. So you read the first one and then ask them to tell you as much as they can remember. And then you read the second one, do the same thing. And then you do some other things for about 10 minutes. And then after that, you say, remember those 2 stories I read to you? Now, please tell me what you can still remember from the first story. And then get it down. And then now tell me, please, what you can still remember from the second story. And these are, the test is norms. So you can look up if you're dealing with somebody who's
Mhm.
23 or somebody who's 35 or somebody who's 68. And compare with other people of the same age and say, okay, well, how well is their short-term working memory for those two little stories? And it doesn't tell you everything,
No, but it's
but
certainly a
it can
more
give you some
practical.
idea of how they're stacking up against other people the same age.
And I think also more applicable to a testing situation
Yeah.
where someone has to read a story. I don't think I would have passed math if we had word problems. I'm great with numbers, but trying to figure out the word problem and it,
Sometimes the worst is figuring, okay, well, what numbers do I actually need to use for solving this?
yes,
How
and
do we plug the numbers into the words?
yes. So do people ever conflate the two stories such that when they're
Oh, yeah,
telling about the second one, they're including details from the first?
often, yeah. And often if they're doing that very much in those two stories, it's likely they're going to be doing it in other things they're interacting with people about.
Sure.
But that that issue of working memory is another piece of an important piece, I think, of ADHD.
Oh, yeah.
And then also controlling action. Now, there's some people where they're, even as adults, they're kind of hyper and talking fast and moving fast and can't sit still and can't shut up. But there are also other people where it's not that they are constantly hyperactive as they get in their teen years or adult years, but sometimes they're impulsive.
Mm-hmm.
I was talking with somebody the other day, and he said at work, there's this woman who works with us, and she's really nice. So all of us like her, and she's a good worker, and she's fun to be around. And she came up to me, and she had this bright colored, multicolored blouse on, and she had this big smile on her face, and said, "Do you like my new blouse? I just got it." And he said, I was preoccupied with other things. I didn't think about what I was saying, but I just said, well, I don't know. I'm not sure those colors look good on you.
Oh,
And he
goodness.
said, as soon as the words were out of my mouth, I knew that was not the right answer to her question.
Mm-hmm.
But
Yeah.
there's no reason on earth why I had to be critical about the blouse. I could very easily have just said, it looks really nice, and I love the color or something like that. But it was a situation where I just spoke without thinking about what I was saying and who I was talking to.
Yeah.
And I
Now,
did not want to hurt her feelings, but there was no reason why I had to say anything negative like that.
and is that
I think,
different than the, I guess, social awkwardness of Asperger's?
yeah, well, I think that that's a good question. I think that there's similarities in that often people with Asperger's are not very good at sizing up how other people are going to respond to what they're doing.
Mm-hmm.
With this guy, it was an unusual response.
Yeah, it was just
He
kind of
wasn't tuned
bingo
in.
first thing.
But many times with Asperger's, they'll be monopolizing a conversation and not read the signals that several other people in the conversation are getting kind of antsy and wish they could have a chance to talk too. Or that they sometimes will be too quick to respond to things
Mhm.
without bothering to listen to what the other person's trying to say.
So there's a difference in the person with ADHD who commented on the blouse. It was just not, didn't even have a thought about what he was saying. And
Yeah, that was impulsive,
Mhm, mhm.
but he wasn't somebody who was generally thoughtless in terms of interacting with other people.
Mhm.
Whereas that sometimes, well, like that one example I read earlier about the little boy who had Asperger's, who was critiquing, and I've seen a number of them like this. He was on a little league team, and anytime somebody came back having struck out, he would explain to him what was wrong with his batting stance.
Yeah,
or
that'll really get you.
yeah, and
quick.
it's the kind of thing where he's just in his mind, he's just giving them some helpful advice,
Yeah, yeah.
feedback.
I'm
And he has
assuming you
no
want to be
clue
able
to
to
the
do that.
fact that this kid who just struck out is feeling disappointed and hurt and had wished that he was going to be able to hit a decent ball. And the Asperger's person often has difficulty with empathy,
Mhm.
being able
Yeah.
to put themselves in somebody else's shoes and taking that into account in the way that they interact with them.
So I want to move on to therapy in both medication, but also are there different approaches in terms of types of what might be called interpersonal therapy, cognitive behavioral therapy, play therapy, maybe at particular ages. And let's start with the medication, because I think that's what a lot of people identify, certainly with treatment of ADHD.
Well, yeah, and that's because 8 out of 10 people who have ADHD usually respond pretty well
Mhm.
to the medicines we have for it. You know, and the medicines that we have, as you well know, cure for AD, the medicines we have for ADD cure nothing. It's not like you have
Yeah.
a throat, you take an antibiotic and it knocks out the infection. It's more like
Right.
eyeglasses. I have a problem
Mhm.
with my eyes. I can't read typewriter size print without my glasses. Put these glasses on, I read it as well as anybody can. Take them off, I'm right back where I started. The glasses don't fix my eyes, they help
Right.
me when I've got
Right.
them on. And in the same way, the medicines we have to offer for ADHD don't cure the problems of ADD, but if you've got an effective dose, and most people, you're going to be able to get something where they're going to be able to compensate for some of those ADHD difficulties.
Mhm.
To slow down a little more if they need to slow down, or speed up a little more if they need to speed up, or being able to get going on things that they've been putting off, stuff like that.
Now,
But the thing that I think a lot of people run into is that many physicians and prescribers who are trying to provide medicine for people with ADD haven't had enough training to recognize that the amount of medicine which is going to be an effective dose for a person with ADD doesn't go much by how old you are or how much you
no,
weigh or how severe your symptoms are. It's how
right,
sensitive your body to that particular medicine.
right, right.
And so as a, you know that well, and I know that, but I know that there are a lot of docs who just figure, well, there's so many medicines you can prescribe according to, how old is the person, how big is the person, and
Yeah, or they read the book and, oh, 20 milligrams ought to be good, and
yeah,
that
exactly.
person really needs 5.
Yeah, and so it usually works best to start with a baby-sized dose and then just
Mhm.
titrate it a little step by step to find that sweet spot between too little and too much.
And I found with, particularly maybe with more severely affected kids, more toward the autism side, not quite so up to Asperger's, but even people with Asperger's, that a very low dose,
Yes.
because they're very sensitive.
You're absolutely right on that. Many of them have very sensitive body chemistries.
Mhm.
And so you want to start very low and
And
then just gradually taper it up and see if you can find that sweet spot between too little and too much.
yeah, I recall one kid, I think he's 17 now, and he was probably 7 or 8 when I started to see him, and it was evident that anxiety was a big part of his thing. So rather than even giving him 5 milligrams of escitalopram, Lexapro, and partly because he couldn't take pills yet,
Right.
he got liquid, and we started at 3 milligrams.
Yeah.
And little by little that worked up. Mom would say, well, now it's doesn't seem to be working as well, so we inch it up.
Right.
And he's taking 20 milligrams and it's fine.
Yeah. Well, it
but-
takes a while to get, with the SSRIs particularly,
Mhm.
it just takes a while for the medicine to get in there long enough. You're talking about 2, 3, 4 weeks sometimes before you can see what it's
Yeah,
doing,
yeah.
obviously.
And then with him saying, okay, let's go with 3 milligrams.
Yeah.
And it was a month. She said, our household's different. He's not.
Yeah, but
coming
tapering
out
it
all
up
the
like
time.
you did with them was, I think, a perfect way to try to deal with that sensitivity.
Mhm. Yeah,
And,
starting way
and
lower
taking
than
it
one might think.
very low and then taking a little bit at a time and seeing what you can do. But it's very true that many people with ADHD and some people with, well, many people with autism spectrum and many people actually with ADHD have a lot of trouble with anxiety. And
Mhm.
some of them, if you give them stimulants, it does
Yep.
help. It's not always the case that the stimulants make people more anxious, but sometimes
Right.
it does.
Yeah,
And
yeah.
I've had some people who responded pretty well to stimulants and their chronic anxiety was less a problem. But then there's some people
Mhm.
who really do need to get into
Yeah, something for the
something else,
anxiety.
and you don't want to
Well,
be using fast acting anti-anxiety agents because those are too easy to get to using too much.
right, right.
And so
Absolutely.
usually you're better off with a smaller dose of
Of an SSRI. Yeah,
SSRI.
and I think that's almost an advantage of the ADHD medicines, that you can see the effect of those very quickly
That's right.
and
And
be able to say, no, we have to pull back.
mhm,
SSRI may take 3, 4, 5 weeks to really.
yeah, which is why you have to taper it in.
Exactly. Are there some symptoms or characteristics of Asperger's which the stimulants, ADHD medications, do not address?
Well, the ADD medicines aren't necessarily going to help them to be able to um, sort of read other people's emotions very well, because they're making judgments too fast.
Yeah, yeah.
And so sometimes rather than just depending upon the stimulants, you want to do it the simple way first. And if you've got somebody who has ADHD that's giving them a lot of trouble, and on top of that, they have Asperger's, which is giving them a lot of trouble. You want to treat the ADHD first.
Right, right.
Because
Which
for
is,
one thing, the medicines that we use for ADHD, you can usually see pretty quickly whether you've got something or you haven't. And so I think that approach makes good sense. But then once you could get that stabilized, then if it looks like they're too anxious or too depressed,
mhm.
or too
Treat
worried,
those.
then you may very much really have a need for adding one of the SSRIs to try to help them with it.
Now, how about in therapy approaches? And I certainly with ADHD need the stimulant so then they can pay attention to what's going on in
Oh
therapy.
yeah, but
Um,
and there's some people who need the stimulants only for certain activities. For example, there's some kids who need it for homework, but they don't need it when they're in a classroom. Other kids who definitely need it in the classroom and for homework.
Yeah, they're so distracted. And
Yeah, and so that varies. But then when you're dealing with the kid with Asperger's, those issues are usually particularly if you're dealing with anxiety, you don't want to be depending on short acting
no,
anxiety
no,
medication
and then,
because you can end up with them getting hooked on them.
yeah. So does cognitive behavioral therapy help someone with Asperger's, for instance, where they can get an awareness of, oh, maybe I could phrase that differently, or
Well, it can, but I think often there's so many different examples that they're running into. Cognitive behavioral stuff works much better when you're dealing with a fairly simple behavior, like being able to keep your butt on the chair in the classroom. And you can set up a reinforcement schedule to be able to get that to work out pretty well. But I think a lot of the work that we have to do with people with Asperger's is didactic work, where you get them to tell you about the incidents that they've been involved in, where I was I was just thinking about it. The same kid who was giving too much advice to
Baseball.
the other people playing a baseball team was also playing basketball, and he was doing the same damn thing with the basketball team. And the kids were really busting his stones, quite a bit.
Yeah.
In terms of any little thing he was doing out of line. They certainly pointed it out to him, and he went, crying to his mother, saying, "These kids are being so mean to me." And his mother said, "Hey, look, there's something you don't realize, and that is that you often telling people what they've done wrong or what they should do better in playing basketball makes them embarrassed and makes them angry, because they feel bad enough that they didn't make the basket, or that they lost the ball when they were trying to dribble up there and shoot. And so you got to watch it. And this is the kind of thing I'm talking about, didactic. It's a matter of trying to get them to recognize the situations in which they tend to do things which are going to be annoying to other people,
and catching them in their own behaviors is going to be more relatable,
right? And get them on the spot.
Yeah, and see, and I think, and I'm thinking of one young man who is one of the tougher people to try to figure out what to approach first, because he does the correcting, but then even if he's explaining something he did and you try to point that out, he goes into proving why he's right.
Yeah. And it's a pretty good way to get other people pissed off.
Yeah, and he doesn't get it even if his parents explain to him. It's just he's convinced he's right.
And so you have to wait for an opportunity when he's complaining about the fact of how people are treating him, and help him to recognize that it's a lot of that stuff is paybacks for the time you were criticizing other people.
Yeah, it goes both ways.
Yeah, and most kids pick it up pretty carefully just by observation. But in the case of somebody with Asperger's, often it's harder for them to be able to catch on.
Yeah.
So the same problem keeps happening again and again.
Well, that's been a great discussion, and Tom, I so much appreciate your time and
thanks, David. I really enjoy talking with you, and I hope we have a chance to talk again sometime soon.
Yeah, I'm sure. You keep writing books and I'll keep reading them and figuring out what we can talk about next.
Okay, I'll do it.
Okay.
Take care now.
All right, you too.
Bye-bye.
Bye. My guest today was Dr. Thomas Brown, who I think of as one of the preeminent thinkers and people in the field of ADHD, and as you've heard, many other psychological problems as well. He's written a number of books, and what I think is unique about his books is that each one builds upon the other. So you could read them all in order, or you could read the latest one, for instance, Outside the Box, where he really dissects all the aspects of ADHD, and those are a culmination of his thoughts over a number of years. So I just think he's a great person to be aware of as far as his expertise, and I hope you have a chance to see and read some of his books, check out some of his webinars on Attitude Magazine or ADDA, or even on YouTube. So thanks for joining me. I appreciate you being here, and we'll talk to you next time.